Good morning. This is Dr. McDaniel at GYN Corner. Today is Wednesday, July 17th. It's hump day. We're having great weather here in New York, tri-state, New Jersey area. They're calling it a heat wave, but it's summer, and summer on the eastern seaboard. We're supposed to have hazy, hot, and humid weather. So it's not really a heat wave. It's just a nice summer. We haven't had a great summer for a couple of years. And we should get weather in the 90s during the summer, and it's supposed to be humid here. Supposedly it's going to be in the hundreds over the weekend. I don't know if I believe that. I guess we'll find out. But it's nice to have a good hot summer because we've had some pretty cold winters lately. Anyways, as the title stated, I'm speaking about dermatology today. It's not going to be a long presentation today. It's just that every day throughout the day I see women for their annual GYN screens. Now, of course, public health announcements and the insurance companies are really recommending that people not screen annually for preventive measures. They'd prefer that you screen every 3 years, every 5 years, because it saves money, it saves society money, it saves insurance companies money. I mean, I hate to be cynical, but really, it's like they say in the movies. You want to know a reason for something? Follow the money. So it used to be, now I do know in Europe it's different, but that's because they've always been worried about the money in Europe. My husband's from Europe, and they have national health systems there, and they've always been tight on the dollar bill. Everyone gets health care, but everyone gets very basic health care. They don't get like champagne health care. They don't get CT scans on demand. Their stomach hurts. They don't get a full battery of tests and see a specialist, GI specialist. So they're used to having very basic care, and if there's a problem, they're used to waiting. They're used to having to pay additional to see a specialist or have extra health care insurance and monies that they're paying to get faster service. They have long queues for everything, and that includes health care. Here in the States, all these young people are screaming, Bernie Sanders, they're all screaming for national health care system here. Americans aren't used to waiting for things. They're not used to waiting for things, and they're not used to getting things on the cheap, especially if, air quotes, the government is paying for something. They're used to getting everything they want. They go into the emergency room. They're used to getting full set of blood tests done, x-rays, CT scan, ruling out every conceivable problem, and seeing a specialist. That doesn't happen in countries where they actually have national health care systems. It doesn't happen in Canada. It doesn't happen in the UK. It doesn't happen anywhere in Europe. My husband's from Europe. I have a lot of European patients who come here and tell me, oh, I'm in the States now. I want to get the works done because I couldn't get it at home. They don't get their PAPs every year. They get their PAPs every 3 years. Now it's every 5 years in the UK. So people here think they're going to get cheap health care, and they're still going to get the same high standards of care and defensive medicine tactics that they've been used to. That's not going to happen. So American society is used to champagne results with a beer budget. They're not used to beer results with a beer budget. It's going to be a rude awakening. But the insurance plans and the public health experts are trying to slowly put people in the mindset that they're not going to get everything that they've been used to getting, and that starts with preventative care. So most Europeans do not get comprehensive health exams with their primary care doctor or their GYN doctor every year. In fact, most of them don't get regular physical exams with the internist ever. They only go to their internist if there's a problem. And here, we're used to recommending that people get a preventative health care evaluation. It used to be once a year. Now they're saying then they started saying every 2 years. Now they're saying every 3 years for the preventative health care. And for the skin cancer screening, everyone used to be told to get their skin evaluated once a year to make sure that there aren't any changes, any moles, freckles that have changed, looking for potential skin cancer. I see women every day, and when I see they have a lot of freckles or moles, I always ask them, have you seen a dermatologist for a skin cancer screen in the last year or so? And the answer 90% of the time is no. And I'm going to say 80% of the time they didn't know that was recommended. They didn't know it was a thing. So, it's a fine line between trying to balance high cost of preventative measures in healthcare versus saving someone from dying from a cancer. But you really have to be your own best advocate. And realistically speaking, if you're fair-skinned and you have a lot of freckles or moles, and it's just a lot of freckles and moles, every summer you get more freckles and moles, or whenever you're out in the sun, especially if you have freckles and moles on the back of your body. So your back, your bottom, the back of your legs, the back of your arms, your neck, those are not areas that you're going to see frequently and going to be able to notice if there's a change. I had a friend years ago who was 24, and he was diagnosed with skin cancer, malignant melanoma. It was on his back. How did he find out? He went to the beach one summer, and two girls on the beach said, "You need to see a skin doctor. You have a really gnarly looking mole on your back." He didn't see it because how often do you look at your back? And sure enough, he went to the doctor because they were like, "You really need to get that checked out. It looks bad." And he had skin cancer. God only knows how long it had been slowly forming, and if it could have been prevented when it was in the early stages, pre-cancerous changes. And this topic came to mind for me yesterday because I saw a patient yesterday for an annual who I'd seen the year before, a young girl. She was 23, and I did as I do, everyone. She had a lot of freckles and moles. Did you see a dermatologist last year or so for a skin cancer screen? She'd never heard of it. Oh, I didn't know I was supposed to. I said, well, I tell everyone if I see a lot of freckles or moles on them or on their back especially, that you're really supposed to see a dermatologist every year. So I asked her this year, I said, "Oh, did you see the dermatologist in the last year or so for the skin cancer screen?" And she said, "Oh, yes, I did. You told me that last year, and I went a week later. I wanted to thank you for telling me that, because when I went a week later, they said I had skin cancer. She had basal cell carcinoma, and she had it removed. She did fine, big excision monitoring treatment, and she's fine now a year later. But she didn't even know she was supposed to see a dermatologist. I didn't actually evaluate her skin. I just saw she had a lot of freckles and moles, and I asked my usual, and thankfully she's one of the few people who actually listened to what I said. And the very next week she saw a dermatologist. It's not very common. Usually people say, "Oh yeah, I'll go," and they may go like a couple of months, or sometimes they'll go, "Oh yeah, I was going to see the dermatologist. I'm going to make that appointment. I forgot. After I saw you, I forgot." But surprisingly, she went the very next week. And they found basal cell carcinoma, skin cancer, and she was treated. But had I not said that, had she not heeded that advice, a year later, she probably would not have done very well, because it was already cancer and it spreads relatively quickly. So I just thought I would mention that and that's not the first time that's happened. That's happened a few times over the years, where someone went after I told them to the dermatologist. They had biopsies, they had severe precancer or very early cancer. So if you have moles or freckles, or you're fair skinned, you should always just see the dermatologist once a year for a skin cancer screen. If you have dark skin, but you have some freckles or moles on your back or your legs or neck, you should see the dermatologist. When I was a medical student, I had a patient in the hospital, a black man, very nice guy, husband and a father. He was dying from skin cancer. He's about my complexion, and he's like, "I don't know how I got it. We weren't out in the sun like a crazy amount, just regular kids in the summer." And his skin cancer wasn't even in a very obvious area. It was in his inner thigh. He's like, "I wore shorts. I don't know how I got skin cancer there." But he got skin cancer there, and he was getting chemotherapy, and it was a poor prognosis. I felt horrible for him because, of course, he was a really nice man. So you have to be your own best advocate. I had a patient about 4 or 5 months ago. She said she went to see the skin specialist, a dermatologist, after I recommended it to her at the annual. And she goes, he made me feel stupid for even going. He's like, why are you here? And she told him, the gynecologist, I'm supposed to get a skin cancer screen. And he's like, really? She goes, he barely looked at her, and he made her feel dumb for going. That's obnoxious. Now, I'm just going to assume that the dermatologists don't get very much money for doing skin cancer screens. But we all do things in medicine that we don't get paid much for. I mean, that's just the way the cookie is crumbling nowadays. We're not making big bucks in medicine anymore. But you're supposed to be doing it not just because you thought you'd make big bucks. If you wanted to make big bucks, you should have gone into internet businesses and the stock market or real estate. So supposedly everyone who's a physician did it because they love science, they want to help people, they want to contribute to society. So, those are the kind of cornball reasons, but in reality, those are actually a lot of the reasons why we go into medicine. So the dermatologists shouldn't turn their nose up just because they're not getting paid any money for doing skin cancer screens. They're potentially saving lives. So when they do the skin cancer screen, they are supposed to evaluate your skin from head to toe. They're supposed to look through your scalp for scalp moles and freckles and changes, ears, eyelids, between your fingers, between your toes, the palms of your hand, the soles of your feet, throughout your back, in between your butt cheeks. They're also supposed to look at the genitalia. Now, I know some of them aren't comfortable looking at genitalia. They'll ask if you've seen a gynecologist recently. That's fine. But if it were me, I would say, yes, I have seen the gynecologist, but I'd also like you to take a look because maybe something new came up. They should do their job. And their job is to look at every single centimeter, millimeter, quarter inch of your skin and make sure nothing's changed. So I hope that's been helpful. This is Dr. McDaniel. I know it was a bit of a rant, but I just realized that a lot of people are not getting skin cancer screens, and they should. So thank you for watching. This is Dr. McDaniel at GYN Corner. Please check out the YouTube channel. That's also called GYN Corner. Check out our website. It's midtowngyn.com. Like, subscribe, comment. If you have questions, please pose them. If you have topics for me to address, please submit those also. Have a great rest of the day, and I'll be back tomorrow, TGI Almost F Thursday.